Welcome. Good afternoon. Welcome to the Assembly Committee on Health and Human Services. Would the Secretary please call the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Assemblyman Hafen. Assemblyman Hibbets. Assemblyman Koenig. Here. Assemblywoman Newby. Here. Assemblyman Wynn. Here. Assemblyman Orentlicker. Assemblywoman Taylor. Present. Assemblywoman Thomas. Chair Peters.
And I am here. Please mark Assemblyman Orentlicker and Assemblyman Hafen as present when they arrive. A couple of housekeeping items before we get started. Just a reminder to please turn off the sound on your electronic devices so we're not interrupting folks. Members of the public may testify in a variety of ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in lieu thereof. Written public comment may be submitted before, during, or up to 24 hours after the meeting's adjournment. If you wish to testify in person, please sign in at the table by the door and leave a card. If you do not wish to testify, you may also want to sign in so there's a record of those who are interested in particular bills in the event that we'd like to get to contact you later. To ensure an orderly flow of discussion, all comments, questions, and responses must go through me. Also, committee members must be recognized by me before you can speak. Additionally, I ask our presenters on Zoom to please leave your cameras off and microphones muted until it's your turn to present or if I direct any questions to you. When testifying in person, please turn the microphone on to talk and off to listen so that we can keep our recording clean. With that, we'll move on to our agenda. We have 4 bill hearings today. We will be taking them slightly out of order. We will start with SB 119 and then followed by SB 348 since we have Senator Donyate in the room with us today, and then we'll move on to the others. I will go ahead and open the hearing on SB 119. Welcome the bill sponsor. Hello, Senator. Thank you for being here today. Senate Bill 119 provides for the continuation of certain requirements governing insurance coverage of telehealth services. Please remember to state your name. You may begin.
Thank you so much, Chair Peters. Fabian Donyate for the record, proudly representing Senate District 10 in central Las Vegas. And good afternoon to everyone. I come before you to speak on Senate Bill 119. I'll try to make this presentation as brief as I can. This bill provides for the continuation of certain requirements governing insurance coverage for telehealth services. So I wanted to give you just a brief background as to what occurred during the interim and what you have before you today. So during the COVID-19 pandemic, we had a big discussion as to what telehealth would look like and how we would reimburse it for people that wanted such access to services. What I would ask is, we had a presentation on the Senate side, and if you look, I believe your committee staff will send you the presentation after today's hearing, and it talked about what states are doing to reimburse for telehealth. So if you go to a doctor, right, and you have an appointment and you perhaps don't have the ability to go in person and you want to do it virtually, there's a conversation and debate nationally as to what that should be paid for. I think there's a big discussion as to what a visit looks like and what a virtual visit should be comprised of versus an in-person visit. But what you have before you in Senate Bill 119 is an agreement with both the folks that are providers and our health insurance groups, where considering the changes that we made during COVID-19 and where we will move forward, beyond this point, considering that a lot of the provisions expire at the end of this year, we will now codify in NRS that a policy of health insurance must provide reimbursement for services described in the following scenarios. So the scenarios that we have said that parity will continue is if you are from or originating from a rural site, if it's aligned to an FQHC, and then also doing for counseling or treatment relating to mental health services or substance use disorders, including for audio only. So if you're able to do a phone call, this will provide the reimbursement for your health insurance group for mental health services. So the rest of the bill are continuing changes. If you look at the original bill, it was to continue on past expiration, but now we have made these revisions. The question you may have is why? We know that telehealth parity is a very interesting conversation nationally, and rather than making the debate harder than it needs to, we just wanted to align to what CMS is doing nationally. And that concludes my presentation. I'm happy to answer any questions.
Thank you for the presentation, and thank you for taking on this bill. So we addressed this policy issue in the 2021 legislative session, and then over the interim, obviously this bill came out of the Interim Health and Human Services Committee as part of our commitment to ensuring we were readdressing this issue, and looking at this policy that had a sunset on it. So I appreciate you and your work on this bill. Are there questions? I have a couple of questions. We'll start with Assemblyman Koenig and move on from there.
So I will make this a question. I like this bill. I think it really helps the rurals, and I think that's a good thing for us, right?
Thank you so much for the question, Assemblyman. Fabian Doñate, for the record, that is correct. We did make sure that we would help the rurals with this bill. That answered the question. Thank you.
That was a good question. I think related to the then Assemblywoman Titus and her concerns on this bill in the 2021 session. I'm going to go to Assemblyman Gray next.
Thank you, Madam Chair. Senator Doñate, good bill. He stole all my thunder, but I do have a question, and it pertains, it's highlighted on the first page, not highlighted, but called out, contains unfunded mandate. And I know we're not a money committee, we're a policy committee, but it's under fiscal note, contains unfunded mandate. I have been looking through here trying to figure out where and what that could possibly be. Is there something we're not seeing? I mean, worked with this, I've been a telehealth patient forever with the VA, and they've done remarkable things out in the rurals, and love the fact that we're finally buying into this, but I'm just wondering if you know what that might be.
Our legal counsel is happy to weigh in on that. Mr. Robbins, please go ahead.
Yes, Eric Robbins, LCB Legal, for the record. So basically, because these telehealth provisions would have completely sunset as far as telehealth parity before the bill, there was a chance we thought that this might cause insurers to have to pay more than they otherwise would have, and because NRS 687B.0369, which is section 1.2 of the bill, is called out in NRS 287.010 as applying to local governments that provide health insurance for their employees, that potential extra costs would have been passed on to them. And it's important to note that just because we note that a bill might have an unfunded mandate, that doesn't necessarily mean that it does. That's just something we put in anytime we think that there's any kind of possibility that there would be an unfunded mandate, so that if a local government were to come back with a fiscal note, that it would be covered.
Thank you, sir, and makes me feel even better about this bill. Good bill, thanks.
Thank you. Assemblywoman Thomas.
Good afternoon, and thank you, Madam Chair. And thank you, Senator, for the presentation. My question actually has to do with, I have no idea about telehealth, have never used it, but I know people that have. And I was just wondering how that billing, how does that work? If you could explain that briefly.
Sure. Thank you so much, Assemblywoman. I will try to condense it as much as I can. So, telehealth. The easiest way to explain telehealth from what most folks know is I have a doctor's appointment. My doctor has in the system where I could call in or see him virtually. And so rather than having to travel across the state, I can hop on my internet and I can see him and talk to him. And then he can prescribe me the same medications that I would have. We would conclude the meeting, and then that's it, right? That's your appointment. Obviously, it's much more complex as to just the encounter that I've described. There has been a national debate as to what I just described, you visiting with your doctor, you talking to him and hanging up after, say, 10 minutes, if that is the same as an in-person visit. Some may argue that an in-person visit in some occurrences should be valued more because when you're in person, they can not just communicate with you, but they could also examine you if they need to. They can see your gait, right? If you're walking in wobbly, they can see that, whereas virtually they wouldn't be able to. Point being, rather than having the conversation as to should we reimburse this the same or should we reimburse it differently, I think it would make sense for this committee and the Senate to consider over the interim what a visit actually entails, and then we can move forward as to how to reimburse it. There's a lot of things that we can do in telehealth. There's remote patient monitoring where we can pay for devices to be sent with patients and we can monitor them from their homes. There are things that are coming perhaps in the near future where we might not even know the technology that exists, but we should reimburse for it. You will see that in other bills, but for this particular scenario, because we find ourselves where there's an expiration coming soon, I believed it was the best interest of the state and of this committee to just reflect what was being done federally. And if CMS reimburses for this, then we should do the same for Medicaid. And that's pretty much the answer. Yeah.
Thank you for the question. Assemblywoman Gonzalez.
Hello, and thank you so much for the presentation, and thank you so much for the bill. I was curious if there was anything regarding consumer protection in the bill. Obviously, telehealth appointments look a lot different than in person, and so I was just curious if that came up in any of your conversations while you were working on this.
Thank you so much, Assemblywoman Fabian Doñate, for the record. So my understanding is this bill specifically pertains to just the reimbursement and parity of telehealth services. It doesn't cover consumer protections or changes to the consumer protections for such delivery of services. That has been covered in other bills. If there's anything of interest that you think we should cover, I'm happy to include it or work on the interim for it.
Thank you for the question. Assemblywoman Newby.
Thank you, Madam Chairwoman. I was wondering, and thank you for the presentation of this bill. Both myself and one of my children receive mental health services via telehealth. And I was wondering, regarding medications, my understanding is that certain medications are now required to have at least one in-person visit. Can you talk a little bit about that and how that would fit into this bill? My understanding is the medications need to be reauthorized at least once a year from an in-person visit.
Thank you so much, Assemblywoman. I will answer just a portion of it, and then if we need clarification, if we can have Mr. Robbins clarify as well. You are correct. For certain medications, there are specifically controlled substances. It does require that the prescriber or the provider see the patient in person at least so often. And so those have been conversations that we've had. I'm not entirely sure if those expire with this, and perhaps Mr. Robbins could clarify, but I think those provisions still remain the same, and it doesn't really affect the payment parity portion of the bill.
Mr. Robbins.
Yeah, Eric Robbins, LCB Legal, for the record. This bill does not affect any sort of provisions about the prescription of controlled substances or other drugs that currently exist. This bill is really just about how telehealth services are paid for.
Does that answer your question? All right. Assemblywoman Taylor.
Thank you, Chair. And Senator, thank you. Thank you for bringing this bill. This is important for a lot of reasons, and with some of the, there's some good things we got out of COVID, if you can say that. And one of them is, the more frequent usage of telehealth, and all of us learning that, that sometimes that can be okay, right? It can be in love. So thank you for that. I do have just a clarifying question. First of all, is the concern that without this bill, because the expiration date is about to come up, that without this bill, then there will be some question as to whether or not this telehealth services continue to be covered?
Thank you so much, Assemblywoman. So that's correct. So in the declaration of emergency for COVID-19, it stated that essentially the reimbursement for parity was tied to it. And so now that it has been removed, there's a question as to what happens next. And so originally the bill was going to remove the sunset provisions, but since we've been working with some of the stakeholders, we figured that for now, rather than getting into the debate of yes, let's reimburse for this or let's not reimburse for this, let's just tie it to what's being done federally and watch what CMS does nationally. That way we can reflect our policies as to what best practices are.
That makes sense. May I kind of, I can say follow-up because that's what we say, but this has nothing to do with that, so there isn't really a follow-up. But my other piece, thank you, Chair, for allowing it, is there's sometimes in some conversations about telehealth, when the reimbursement or when the cost is less, that insurance companies then sometimes kind of force, if you will, patient care to telehealth instead of going in if they save money on that. Did you find anything in that, in the work that you've done in your conversations with stakeholders?
Thank you so much, Assemblywoman Fabian Dunyati, for the record. So just to clarify, I think your question is, have there been situations where they divert patients to use telehealth in some scenarios?
Yes, because of some cost saving, yes.
I think, Fabian Dunyati, for the record, I think it's usually the reverse. I think that what you will hear is there's value in being in person versus remote, and you can't get everything remote. But I come from the perspective that remote is better than nothing, right? Patients who don't have access to travel, say 30 miles from Pahrump into Las Vegas, right? They deserve access to care. And if a physician, either from the state or from outside the state, can provide this level of care that the patient needs, then we shouldn't be restricting them from getting access to care. Now, there's a question as to how much is too much and how much does that get paid at the end. And I think that's something that we have to debate more specifically. But because we're in this weird situation where it's going to expire pretty soon, I felt that the best policy forward was just to follow what the federal government is doing.
I see. Thank you, Senator. Appreciate it. Thank you, Chair.
Thank you so much. And as a mom with 3 kids who were chronically getting ill for a period of time, telehealth saved our butts, especially during the pandemic, when going to an urgent care with 3 kids in tow at varying levels of ill was just unreasonable. And there are some benefits for sure, but that's why it has been vetted through our body, right? It's because sometimes those benefits have costs associated with them. So thank you. It looks like there's a good balance in this, and I appreciate your commitment to continuing to work on this in the next legislative interim. Are there any other questions before we move into testimony? Seeing none, we'll go ahead and move into testimony. We will start with support testimony in the physical locations and then move to the phones. I would invite folks. All right. Please remember to state your name for the record. You may begin when you're ready.
Good afternoon, Madam Chair and members of the committee. Leah Case, Leacase, here today on behalf of the Nevada Psychiatric Association in support of SB 119. A big thank you to Senator Dunyati for bringing this forward and working with us to make sure that audio-only pay parity for behavioral health continues. Just a quick story from when the psychiatric residents came to visit here at the legislature. One of the residents works at the VA hospital and told us this story about working with a veteran who had difficulty leaving his house. It caused extreme anxiety. He couldn't do it. Through telehealth and through the skills of this psychiatric provider, he was able to not only come in to the VA for services, but now he is social. He's going to dances. He's learning to swing dance, and that is the difference telehealth and telepsychiatry can make. So with that, the Nevada Psychiatric Association is in full support. Thank you so much.
Hello, my name is Abby. I am with the National Alliance on Mental Illness. At 3 years old, I was diagnosed with bipolar disorder. I experienced manic episodes and rapid cycling. My favorite cartoon character was Taz because I felt I could spin just like him. Physically, I could not stop. I had so much sadness, anger, and anxiety all at once. By middle school, the mania turned to depression. I was bullied by other students, which led to binge eating. I went to multiple schools promising resources and support that never materialized. At one school, the principal called me in every day to tell me I was hopeless and helpless and never going to amount to anything. If you're emotionally abused every day, you start to believe what you hear is true. I tried to commit suicide at 10 years old. My family was devastated. The right kind of resources are hard to find, nearly impossible. Throughout my medical care, I learned coping skills. The ones that helped were art, poetry, and singing. Medication gave me the ability to want to try to live my life. It took a lot of time to find that inner strength, and I still battle bipolar every day. But my past does not define me anymore. I want children to know in the worst of times, when it's hopeless, and it feels like no one cares or is even listening, there is hope. Better days are ahead. I support SB 119. Thank you.
Good afternoon, Madam Chair and members of the committee. Those of you who are mothers, I hope you had a great day yesterday and that we have a great week here in the building. So I am Sarah Adler. I am happy to represent today Vitality Unlimited and New Frontier, which are CCBHCs and residential substance abuse treatment centers in rural Nevada, and also the Nevada Advanced Practice Nurses Association. All three of these organizations would share with you the critical importance of telehealth. Actually, kind of a silver lining to the pandemic, pushing people away from hospital or clinics, was to find out how effective telehealth was, especially for people with social anxiety who are now receiving very effective treatment, continuing to do so through telehealth. So thank you very much to Senator Donyate, and we support SB 119. Thank you.
Hello, Chair Peters and Committee. Elise Monroy, Marsala, here today on behalf of the Nevada Public Health Association. We thank Senator Donyate for bringing this bill forward. Access to transportation is a key social determinant of health, and my guess was at least a couple times this session you have heard about the challenges Nevadans have with transportation. So ensuring that our that pay parity exists and our providers can be made whole in providing these services is really important. As we can, people who don't have transportation, if they can use telehealth and our providers can be whole, that's a good situation all around. Please support this bill. Thank you.
Good afternoon, Chair Peters and members of the committee. I am Nancy Bowen, the CEO for the Nevada Primary Care Association, representing the state's community health centers, also known as the federally qualified health centers. Telehealth is vitally important to our patients, as 91% of patients have incomes below 200% of the federal poverty level. In 2021, health centers provided almost 113,000 virtual visits, over 25% of total visits for that year. It is critical that the state continue to reimburse for these services so our patients do not lose an effective and competent way to access health care. Please support SB 119. Thank you.
Good morning, Madam Chair, members of the committee. My name is Joan Hall, representing Nevada Rural Hospital Partners, and those hospitals, 17 rural health clinics that are considered in this bill. Through the pandemic, we did learn a lot of important lessons. Telehealth was one of the positives. Reimbursement parity for the distant site, which is where the patient or where the care provider is very important that continues, and that's stated in this bill. The audio only is also very important for rural members, especially for the elderly and the youth. We saw a lot who didn't have access to adequate bandwidth to do a Zoom meeting, so audio worked for them. We have suggested a friendly amendment to Senator Donyate to expressly put in NRS 629.519 that behavioral health providers do not have to be licensed in the state of Nevada to be able to provide the counseling services that we found so important. We hope that you'll pass this bill. Thank you.
Thank you so much. Just for clarification, do we have that amendment? Have you sent that into the committee? Okay.
No, we just talked about it today.
Oh, okay. All right. Well, we look forward to seeing that when it comes up. Thank you. Please go ahead.
Hello, my name is Corey Nieto. I am the Director of Telehealth Services at Nevada Health Centers, a federally qualified health center with offices in Carson City, but actually 18 locations across the state, both rural and urban. I've been involved in telehealth since 2011 in the state of Nevada and have been able to roll out services to community members across the state. Strongly support telehealth parity for for telehealth services. I see every day 18% of all of our patients today are seen through telehealth services, not only rural but also urban. We serve the underserved. There's patients with social determinants of health that do not give them the accessibility to medical care like they would without telehealth. They use it every day with great satisfaction rates. So I strongly support that. Also from a behavioral health standpoint, I support Nevada Rural Hospital Partners amendment to this bill. Thank you.
Good afternoon, Patrick Kelly, Nevada Hospital Association. We support the bill, and with the health professional shortage areas we have in the state, it's very important that people have access, and we think this bill will help that. Thank you.
Barry Cole, B-A-R-R-Y-C-O-L-E. I have actually been a telepsychiatrist, and it's fascinating. I want to tell you about the upside. The upside is I get to see people in their real environment. They don't put on airs and come to a clinic. I come to them wherever they are. Loading docks, lunchrooms, and living rooms. I have seen people with their kids, with their spouses, wherever they are. That's where we provide the service. It is important that in mental health that we still preserve the audio only, because what I've discovered is when they're in a hospital environment, broadband width is good enough. When they're in their home environment, it may not. And sometimes I could have a choice of seeing or hearing, and I would opt to be able to hear my patients. We could do almost everything except maybe draw blood in their home. They still had to come to a hub, but we could get labs drawn by scheduling them. We could do EKGs if they had to be done by scheduling them. And I was able to get very good histories, make treatment decisions, write prescriptions, and have the medicines taken. One of the interesting things I found was the compliance was better with telehealth than I would have expected. My initial suspicion was people wouldn't value it if they didn't have to schlep to an office, but when they were in their own homes, I found that they would often be much more compliant. So I urge you to do pass SB 119. Thanks.
Thank you, Mr. Cole. Welcome back to Nevada. Are there, seeing nobody else coming up to the table in support and nobody in Las Vegas, we go to the phones at BPS. Is there anyone on the phone line for support testimony on SB 119?
To testify in support of Senate Bill 119, please press star 9 now to take your place in the queue.
Good afternoon, Madam Chair Peters and the committees. This is Dora Martinez representing the Nevada Disability Pre-Action Coalition. We wholeheartedly support this bill. Thank you to the sponsor. I want to let you know that I am blind and such don't drive yet. This was very helpful when in the peak of the pandemic, when all of my sighted guide, my kids were sick, and my son was a smart aleck and said, "Mom, here's the car key. Please take us to the clinic." But then by that time, I had to schedule a telehealth, and they were able to assist my children. I also want to let you know that I was able to help my friend who is deaf, and he used American Sign Language. I helped him connect to the ASL program, and he was able to connect that service to his doctor, and they were able to help him through the communication. He had a good bandwidth, so he was able to get the video version. So thank you so much to the sponsor, and thank you to you, Madam Chair. Have a good day. Take care.
Thank you, Ms. Martinez. Next caller, please.
Chair, there are no callers to testify in support at this time.
All right, we will move into opposition testimony on SB 119 in our physical locations and then move to the phones. Is there anyone who'd like to provide opposition testimony today? Seeing none in our physical locations, BPS, is there anyone on the phone line to provide opposition testimony on SB 119?
Chair, there are no callers to testify in opposition at this time.
All right, we'll move us into neutral. Is there anyone in our physical location to provide neutral testimony today? We have one coming up in Carson City. And please remember to state your name for the record.
Yes, thank you, Madam Chair. My name is Helen Foley, and today I'm representing the Nevada Association of Health Plans. It's a 10-member statewide organization that deals with all of the insurance for groups and small groups. And we want to thank the sponsor, Senator Dunyate, for working very diligently on this to find a solution that all of us can agree on. We really appreciate that it conforms with federal law and just want to thank him very much.
Thank you. Seeing no one else coming up to the tables in our physical locations, we will move to the phone. BPS, is there anyone on the phone line for neutral testimony on SB 119?
Chair, there are no callers to testify in neutral at this time.
All right, invite the bill sponsor for waiving closing remarks. We'll go ahead and close the hearing on Senate Bill 119 and open the hearing on Senate Bill 348. Senate Bill 348 revises provisions relating to health facilities. Thank you for being here again on this bill today, Senator. Please remember to state your name. You may begin when you're ready.
Thank you so much, Chair Peters. I'm reconfiguring my computer. If you give me one quick second. So for the record, Fabian Doñate, proudly representing Senate District 10, which is in central Las Vegas. I wanted to come before you all to present Senate Bill 348, which revises provisions relating to health facilities. So my presentation for this one is a little bit unscripted because I think it's important for you all to understand why this is a personal bill. You know, as part of our recovery efforts from the COVID-19 pandemic, I think that many Nevadans recognize that we need to support our healthcare workers and the facilities that exist, and that we need to do a better job of reforming and improving our healthcare infrastructure. We know that there are rising levels of health expenditures that have led to current health disparities, and that the healthcare system is not equal for everyone. And that's what you see in Senate Bill 348. I believe that the vulnerability of our healthcare system is a serious matter that involves everyone's input, and that we need to do transparency efforts to maintain how our healthcare system coordinates with one another. What you see in Senate Bill 348 is part of my response of stabilizing our healthcare system. I believe that by stabilizing our healthcare system, we can put good policies in place to protect not just the consumers, but also other healthcare providers. In recent years, there have been growing advocacy efforts from the residents of Clark County for the increased investment of health facilities in East Las Vegas. For example, so here's the reality of why I brought this bill forward and why you see some of the folks, the assembly members and the legislators that represent the East Side co-sponsored. We had a hospital that closed in our neighborhood not too long ago, and it was very saddening for us. You know, if you grow up on the east side of Las Vegas, say, I went to high school at East Korean Technical Academy, which is all the way by the mountain. For you to travel to a nearby hospital can be miles, time, delayed care, because you have to travel longer distances. And so what I saw with the closure of the hospital was that not only did we experience what other parts of the state experience, but there has to be a good collaboration with one another as to how do we prepare for when a hospital closes in our own neighborhoods. I think if you are a consumer of healthcare, you deserve to know where do you have to go next now that the hospital has been closed. And if your hospital changes over to a different type of facility, we should have a conversation as to what that facility will turn out to be. Senate Bill 348 aims to accomplish the following. It helps our state join others in creating monitoring tools to better understand as to how our state's healthcare infrastructure is influenced. It identifies transparency efforts that can focus on affordability of healthcare and focuses to reduce any barriers that residents face because of the closure of facilities. I believe fundamentally that Nevadans deserve to know when their local hospital is about to close and where did they receive the healthcare services once that closure occurs. And as policymakers, we need to ensure that our residents and our clinicians are equipped and informed of major healthcare decisions that can impact or reduce the institutional quality of care. I'm happy to walk through the bill, but in the interest of time, I'm happy to answer any questions on the provisions outlined.
I think folks have had the opportunity to review this bill, so we can go ahead and jump into questions. I have our first question from Assemblyman Ornlicker.
Thank you, Chair, and thank you for sponsoring this bill. So I appreciate the concern because, as you say, losing a hospital on the east side is a big loss. So as I read it, the director at HHS has to approve a closure, and that's in section 2.1. And then in 2.3, it talks about the information that has to be submitted and be considered by the director. But what I don't see is any criteria for how the director will decide. Am I missing that? And because it looks like they've got unlimited discretion in deciding, as opposed to giving them some principles on which to decide.
Thank you so much, Assemblyman Fabian Doñate, for the record. So in section 2 of the bill, it says, it outlines, so we're only looking in facilities with a county of 100,000 or more. And it outlines that if a county, or if a hospital in a county in the urban areas would like to close and convert to a different type of health facility, then that is when they would have to have the approval from the director of HHS. And then the criteria that they have to provide is the location of the hospital, the ownership structure of the hospital, whether the closure or conversion is likely to benefit any other health facility in a geographic area, and then the explanation as to when the closure or the conversion will occur, and then data regarding the population that you have taken over. So I'll give a very clear example. When Desert Springs closed, right, from the healthcare executives that I've talked to, that are my friends that work in different institutions, if you relied on that hospital facility to take care of your needs, now that it's closing, there should be some level of coordination with the other hospitals nearby. What we saw with Desert Springs was it was converted to an emergency room only, so that is the only part of the operation that will continue on. But if you have to have more severe cases, right, you have to understand that you won't be able to receive all the services that you originally had now that they have closed or a portion of their facility. I believe that conversation should be held publicly. Once the notification occurs that there is a decision that the hospital will close, that should go to the director, and the director should have input as to how that coordinates with the other health facilities that now have to pick up the mantle. And so that's the criteria that we laid out. Again, it's not permission to close a facility, it's if you want to convert it to something else.
You have a follow-up?
Yeah, follow up, please. Okay, so I'm not sure, because as I'm looking at section 2.1, if you can't close a hospital or convert it without first applying. Seems like both are in section 2.1. So did I misunderstand you? I thought you said it's only for conversion, but it looks like you can't close or convert without approval.
Thank you so much, Assemblyman Ornlicker. Fabian Doñate, for the record, I think you're correct. It's or more, or there's an or in there, so I will have to revise that when it comes to if there is an amendment to be presented. So thank you for catching that.
Thank you. I have another question from Assemblywoman Taylor. Please go ahead.
Thank you, Chair, and thank you, Senator, for bringing this bill. I live in the north, as you know, but I've certainly had several conversations about the closing of the hospital in that part of the city, of the valley. My question, I'm going to try to find where it is again. Here it is. This is on page 4. Let's see what section. Looks like section 4, sub 6. I'm looking around where there's an administrative penalty or fee for a physician group or you see for a hospital, physician group, or a person who violates any of this, and I'm wondering. I think I see that from how a a physician group or a hospital can do that, can an individual person, can an individual person, violate this, not adhere to it, and what would that look like?
Thank you, Assemblywoman Fabian Doñate, for the record. So this particular section of the bill is cleanup language for what was enacted by the legislature beforehand. This particular section just says that there's an enforcement mechanism, which is the administrative penalty. So last session, Senator Lang passed a bill that was signed by the governor that said, if you are a hospital or a physician group practice or a person who owns all or substantially all of a physician group practice, and you're going through the merger or acquisition, that you have to disclose it to the department. And so this bill just clarifies that if you don't do that, then you have an administrative penalty. So it's just cleanup language for what was passed last session.
So if I may follow up, Chair? Thank you. So really, it's saying that that isn't, because in my mind I was thinking if it's a hospital that closed, not an individual person can't do that. But that's really the personal $5,000 administrative penalty is really intended for if there's a physician group practice, because otherwise one person wouldn't be responsible for closing the hospital and informing, right, the director is it. But if it's a physician group practice, then the person who owns that practice, the majority owner, then that person will be held responsible. Is that kind of the intention here?
So Fabian Doñate, for the record, Section 4 of the bill does not deal with the hospital closures at all. This just says that we're pretty much cleaning up the language of a bill that was passed last session, which deals with mergers and acquisitions of hospitals and physician groups.
Okay, I may have to ask you about this offline, because I'm reading it and that's not what I see, so I can do that. I'm fine with that. Thank you, Chair.
Thank you. Yeah, the initial reading I had was section 1 or 2, but it says subsection 1 or 2, so it pertains only to that section 4 language. Appreciate you taking that offline, though, to get some clarity. Any other questions from the committee before we move on to testimony? Seeing none, we will go ahead and move into testimony. We'll start with support testimony in our physical locations and then move to the phones. Is there anyone in Carson City or Las Vegas who'd like to provide support testimony on SB 348? Seeing none, BPS, is there anyone on the public line for support testimony on SB 348?
To testify in support of Senate Bill 348, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to testify in support at this time.
Thank you. We'll move into opposition testimony. Is there anyone in Carson City or Las Vegas who would like to provide opposition testimony today? Seeing no one coming up to the desks, we'll move to the phones. BPS, is there anyone on the phone line to provide opposition testimony on Senate Bill 348 today?
Testify in opposition to Senate Bill 348, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in opposition at this time.
Right, that takes us to neutral testimony. Is there anyone who'd like to provide neutral testimony today in our physical locations? I would welcome you to the desk. Please remember to state your name for the record. You may begin when you're ready.
Chair Peters, members of the committee, Connor Kane on behalf of HCA Healthcare, which includes Sunrise Hospital and Sunrise Children's Hospital, in neutral on Senate Bill 348. Sunrise Hospital and Sunrise Children's Hospital take immense pride in caring for patients on the east side of Las Vegas. We know that the sponsor shares our desire to ensure that these folks have access to and receive the best health care possible. That's why Senator Doñate decided to bring this bill that's in front of you today. We thank the sponsor for his hard work to drive a compromise on Senate Bill 348 and appreciate the opportunity to appear in front of you in neutral. Thank you.
Thank you. Anyone else in our physical locations? Seeing no one coming up to the desk, we move to the phone. BPS, is there anyone on the phone line for neutral testimony on Senate Bill 348?
To testify in neutral for Senate Bill 348, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you so much. I would ask the bill sponsor closing remarks. Waiving closing remarks, we'll go ahead and close the hearing on Senate Bill 348. Thank you, Senator. It was wonderful to have you in Assembly HHS. We have Senator Lang here today with us to present Senate Bill 146. I'll go ahead and open the hearing on Senate Bill 146, which revises provisions relating to health care. Please remember to state your name before you begin. You may begin when you're ready.
Thank you so much, Chair Peters and committee members. My name is Roberta Lang, and I represent Senate District 7 in Clark County. Thank you for the opportunity to present Senate Bill 146, which prohibits a health insurer from denying certain health care providers from entering into contracts under certain circumstances. I'd like to first give you a little bit of background, then I'll go through the parts of the bill. Nevada faces a persistent shortage of nearly every type of healthcare providers, including doctors, mental health professionals, and nurses. The number of healthcare providers per 100,000 population remains well under the national average, according to the Health Workforce in Nevada, a chart book of 2021. The state would need an additional 307 family medical physicians, 807 nurse practitioners, and 4,209 nurses to equal the national per capita for each occupation. There are many factors that influence not only whether healthcare providers practice in Nevada, but whether they choose to stay. These include availability and capacity of health education and training programs, licensing and regulatory practices, recruitment, retention, and in this case, health carrier networks. Nevada is desperate for quality healthcare providers, and it's important that we remove barriers that prevent practitioners from coming to practice in our state, and most importantly, staying. Additionally, it is imperative that we provide existing healthcare workers in our state, such as certified nurse midwives, with more flexibility to provide quality services. I'm going to share with you a brief story about a cardiologist that came to practice at the UNLV Medical School. He was a well-known cardiologist. He came to UNLV Medical School. They were ready to hire him. And when he went to try and get on a healthcare panel so that he could also practice medicine in the state of Nevada, they told him their panel was full. They had no more room for doctors in his specialty. And so he chose not to go to UNLV Medical School. And that is what has precipitated this bill. It's an opportunity to say, if we get in a medical school in Nevada, if we want to bring in doctors, then we have to find a way to get them on the healthcare panels. It doesn't mean that get to bypass all the regulations that people have to go through to get on a healthcare panel. It just means that they get to jump ahead of the line and work through the process to be able to get on the panel so that they can also practice medicine and work at the medical school. So I think by relieving these barriers, we increase the pipeline for doctors, nurses, teachers, and other important healthcare providers that come to practice in Nevada, and they will stay. As for increasing flexibility for our certified nurse midwives, this bill extends the existing regulation that allows for a physician of medicine or osteopathic medicine to perform a physical examination on a patient to also include certified nurse midwives. It authorizes them to perform physical examinations and obtain a medical history before or after a patient is admitted to the hospital for childbirth, slightly but efficiently expanding their scope of practice. Unfortunately, Dean Kahn from the UNLV Medical School and the Dean of the Medical School from UNR couldn't be here today. They co-presented with me in the assembly.
Excuse me, I'm here.
Oh, you are? Oh, hi. I'm so excited.
I didn't realize you were there in Las Vegas either. I will let you proceed with the presentation. Please remember to state your name for the record when you speak.
Kahn.
Hi, my name is Mark Kahn, M-A-R-C, last name Kahn, K-A-H-N. I'm the Dean of the Kerkorian School of Medicine and Vice President for Health Affairs. Thank you, Senator Lang, for presenting this bill. Thank you, Chairperson and members of the committee. So, as Senator Lang so eloquently stated, this proposed legislation is important so that the schools of medicine in the state can hire the necessary cadre of specialists and subspecialists to educate the future workforce for the state.
And with that, Chair, we're happy to answer any questions the committee might have.
Thank you so much for the presentations, and thank you for being here, Dean. Are there any questions from the committee on this bill? Assemblywoman Thomas, please go ahead. Would you mind turning the microphone off in Las Vegas? We have a little reverb that comes in from there. Thank you so much.
Thank you, Madam Chair, and thank you, Senator, for this presentation. My question, I'm a little confused. When we talk about, in your bill about nurses having the ability to examine a patient in, I guess, gynecology, or is it just for, for when we're having a baby, obstetrics? I want to know, because I know myself personally, my children were examined by nurse practitioners, and I was just wondering, is that different? Is this bill addressing that? I'm a little confused.
Roberta Lang for the record. So the nurse midwives can already go on the hospital floor. This gives them permissions to do those examinations when someone is getting ready to have a baby and they go to the hospital. Does that help?
All right, so clarity. So it's for midwives?
Yes.
Okay, got it. Thank you.
Other questions, committee? I guess I had a question related to the panel that you were that you mentioned. So, can you clarify when you're referring to the panel, especially in the academic setting, which panel you're referring to?
Roberta Lang for the record. So what I'm referring to is the health insurance panel. So you have your health insurance company and they have a panel of doctors that are covered under your insurance. And so doctors come into Nevada and they try and get on those panels and become preferred providers. What the example that I gave you with the cardiologists, they tried to get on the preferred provider list, and they were told that their panel was full for cardiologists, so they couldn't get on, so they didn't want to practice medicine because, frankly, it's not affordable to just teach, and he wanted to have his practice as well. And so that's the panel I'm talking about. So if someone's coming and they want to teach, if I'm offered a position at the UNLV Medical School and I'm also trying to get on a panel, the insurance company is required under this bill to start processing my application to get on the panel. It doesn't mean I automatically get on. They have to make sure that I meet all the provisions of someone joining a panel, but they can't say it's closed.
And does this pertain to any insurance that you apply, that a physician would apply for to be impaneled, or is it specific to the first one that they apply to? What is the?
Thank you for the question, Chair. Roberta Lang for the record. It applies to all panels.
Thank you so much for clarifying. Assemblyman Nguyen.
Thank you, Chair. Sorry, I thought I didn't have a question, but as I was reading this again, I just want to make sure I clarify this too, since you asked that question, Madam Chair. Senator, I'm just wondering in terms of enforcement, I'm worried that there might be set up, because the language says that, meet any credentialing requirement, right, or meet determined conditions. What if there are loopholes that those carrier, I'm not saying they are, but sometimes there could be bad actors out there that's trying to prevent a physician from adding on to the panel. Who enforces this part? Does the Board of Medical Examiner or State Board of Health, or the insurance department? I'm not sure who is the oversight, so that if this physician if a future physician has issue with this particular law, and where they can go to get that resolved.
Roberta Lang for the record. So I've never really thought about that, to be honest with you. I'm happy to check with who would be the oversight, but maybe your legal could offer some insight.
Thank you, Mr. Robbins. Please go ahead.
Yes, Eric Robbins, LCB Legal for the record. So Chapter 687 is in Title 57, which is the insurance title. So all of those provisions are enforced by the Commissioner of Insurance.
Great. Thank you, legal. Thank you, Chair.
Thank you. We have another question from Assemblywoman Newby. Please go ahead.
Thank you, Madam Chairwoman. I actually have two questions, if that's okay. Thank you. When we speak of medical schools in this bill, I know we have Dean Kahn there with us in Las Vegas, but I'm assuming this applies to all medical schools in the state, both private and public?
Roberta Lang, for the record, that would be correct.
Thank you. And then when I heard you and Dr. Kahn or Dean Kahn talk about teaching and bringing in folks to teach. When we talk about teaching, do we mean in the medical school or in graduate medical education residency type of situation, or both? Because we know that GME is a really important piece of bringing and keeping doctors here.
Dean Kahn, would you like to take that?
I would, thank you. Mark Kahn, Kahn, for the record. Thank you, Assemblywoman Newby. This would be in multiple settings, classroom and clinical setting, but to get on panels, that's going to be required for the clinical setting. So this really specifies that, or would allow for specialists and subspecialists to be allowed on panels so they can see patients and be compensated for doing so. Thank you.
Thank you for the questions. Assemblywoman Gorlow.
Thank you very much. I really like this bill. I think the panels have been an issue for quite some time on not letting doctors participate and help the community. But I guess my question kind of wrapping around is there something we could do more to make sure not just those that are coming in to teach, but those that may want to just come here after they graduate or set up a new practice. They decide they want to move to Vegas because it's beautiful weather, or they want to go to Reno because, hey, they're skiing in Tahoe. I know, looking at my own panels, some of those doctors haven't practiced for years. And so there's a cleanup of some of those panels that I think need to be happened too. So I guess my main question is, could we expand this to include others?
Roberta Lang, for the record. So we had conversation about making it open. It was too much to take on in this session. There was too much opposition from the medical profession and the insurance providers. And so it was going to take a much lengthier conversation. And so we decided to narrow it down to exactly what we were trying to do, which was to get more doctors in the medical school and increase the pipeline.
Thank you. I do appreciate that. And I guess I'll put this on the record that, you know, I've worked with several doctors, had a pediatric pulmonologist, which we do not have enough in the state, who couldn't get on the panel. My daughters needed a pediatric geneticist. There's none in the state for that. So for whomever is listening, let people practice. So thank you.
Thank you for the comments. Yeah, this is really a pervasive issue at the moment. I was just talking to my someone, a retired firefighter, cannot get access through their insurance, their retirement insurance, to a cancer provider in the state. Yeah, it is wild. So they have to they have to purchase the flight and transport themselves and stay for those cancer treatments in another area because there is no one impaneled under their insurance in the region that they live in for that kind of care. And not that they don't exist, right? But that's a network adequacy issue that I would encourage anybody interested in to take on in the next legislative session because it does seem endemic. Assemblyman Hibbets, please go ahead.
Thank you, Chair. And I think this might actually be more of a technical question for legal as opposed to the senator, which, by the way, thank you for coming. It's nice to see you. So my question is, what do these two issues have to do with each other, and how is it under one bill?
Eric Robbins, LCB Legal, for the record. So bills that are, you can put whatever, or legislators can put whatever subjects they want into a bill as long as they can conceivably fall under a single subject. And here, both of these issues are related to healthcare, so it works under the single subject rule.
For clarification, is NRS 449 and I forget where the other one is, I apologize, the second NRS, are they both under the same chapter by any chance?
Eric Robbins, LCB Legal, for the record, they are not.
I just wanted a little clarification. Appreciate that. Thank you.
We learn something new every day. Maybe next session it will help you with bills too. I do not see any other questions from the committee members. Thank you so much for the presentation and information today. We will move into testimony, starting with support testimony in our physical locations. Thank you, Dean Kahn. I don't know if there's anyone else in the room up there, but if they make it up to the table for testimony, we would like to invite them. And we'll start here in Carson City. Please remember to state your name. You may begin.
Joan Hall, representing Nevada Rural Hospital Partners. Here in support for SB 146. Our rural hospitals often have certified nurse midwives, so having this clarification in the statute will really assist them. It's hard if you've had a certified midwife and then you have to have a stranger do your physical exam and your whole history so you can have your baby. So we're appreciative of that. We also believe that the med school physicians on these insurance panels assist Nevada in attracting specialists to our universities, something very important to increase our workforce pipeline. Thank you.
Thank you. Seeing no one else coming up to the desks in our physical locations, BPS, is there anyone on the public comment line for support testimony on Senate Bill 146?
To testify in support of Senate Bill 146, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in support at this time.
Thank you so much. We'll move into opposition testimony in our physical locations. Is there anyone in Carson City or Las Vegas who'd like to provide opposition testimony to Senate Bill 146? Seeing none, BPS, is there anyone on the public line for opposition testimony on Senate Bill 146?
To testify in opposition to Senate Bill 146, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in opposition at this time.
Thank you so much. We'll move into neutral. There's neutral testimony in our physical locations, Carson and Las Vegas. Please come up to the table. We'll start here in Carson City. Please remember to state your name for the record. You may begin.
Thank you very much, Madam Chair. For the record, my name is Helen Foley, representing Nevada Association of Health Plans. We want to thank Senator Lang. We went back and forth with her many times. She was open, she was cooperative, she was very diligent in making sure that Dr. Kahn could meet his needs and get the best doctors here and make sure that they could participate in panels, while at the same time taking into account some of our concerns. And we thank her very much for this legislation.
Thank you. Seeing no one else coming to the tables in neutral, we will move to the phones. BPS, is there anyone on the public line for neutral testimony on Senate Bill 146?
To testify in neutral for Senate Bill 146, please press star 9 now to take your place in the queue. Chair, there are no callers to testify in neutral at this time.
Thank you so much. Would you like, we're waiving closing remarks. Thank you. We will go ahead and close the hearing on Senate Bill 146. Thank you so much, Senator, for spending some time with us today. We'll move on to our last bill hearing of the day, Senate Bill 411. Welcome, Senator. Please remember to state your name when you begin, and you may begin when you're ready.
Good afternoon, Chair and members of the committee. For the record, James Orenshaw, I represent State Senate District 21. Really an honor, privilege to be before your committee. This is a committee I never had the opportunity to serve on when I was serving in the Assembly, but got to present some bills and glad to be here today. Thank you for hearing Senate Bill 411. Senate Bill 411 comes out of my experience in my day job as an attorney who represents children. I'm a deputy public defender at the Clark County Public Defender's Office, and I work with children who've been arrested, been cited for delinquent acts. And there's a program that Judge Bailey, who's joining us via Zoom, started down in Clark County called Day Court, Detention Alternatives for Autistic Youth. And it's a therapeutic diversion court, which I've witnessed help so many children that it's truly an amazing thing. And during the interim, I was talking with families and some autism advocates, and one thing we really had hoped is that there'd be programs like this across the state for children who maybe have not received treatment, have not been properly diagnosed, to try to get the therapeutic treatment that can help them and help them succeed and not end up back in the criminal justice system and the delinquency system. With your permission, Chair, if I could turn it over to Judge Bailey, and then I'm happy to answer any questions about Senate Bill 411.
Welcome, Judge Bailey. Thank you so much for being with us today. Please go ahead.
Good afternoon, and it's Sonny Bailey, Soonhee, last name Bailey, Bailey, and I am a judge in the 8th Judicial District Court in the Family Division, and I currently serve in the Delinquency Division of the Family Court. I'm sure that you've already heard quite a bit about autism, but currently the statistics say that the CDC estimates about 1 in 36 children are diagnosed with autism spectrum disorder, ASD. It doesn't discriminate against race, ethnicity, or socioeconomic, but it does have a diagnosis for boys 4 times higher than that of girls. And youth with ASD often display inappropriate behaviors in various situations. And although aggression is not a symptom of ASD, youth with autism sometimes behave aggressively towards themselves or others. This can lead to charges. Often we see battery on a protected person, battery, domestic violence, threats to cause bodily injury. And these types of behaviors can create dangerous situations, not just for their own family members, but for other students, teachers, first responders, medical personnel, and the public in general. And it's currently unclear how many youth, diagnosed or undiagnosed, with ASD are currently in the juvenile justice system in the United States. It's even more difficult to gauge how many adults are in the criminal justice system or prison system with ASD. The last study, and the only study that we could find, was back in 2012, where they only had a population of 431 prisoners that they looked at, and approximately 4.4% had ASD prevalence, double the general population. Many go undiagnosed. More recently, they estimated, when they took that percentage, they believe that there's over 100,000 adults in the U.S. prison system with ASD. That doesn't include those that may be undiagnosed. Many states are attempting to address the issues of the adults with ASD in the prison system, often with weighted blankets or maybe lights that are turned lower, things like that. But that's quite honestly too late. SB 411 aims to prevent youth or adults with ASD from ever getting into that system. And it allows courts to create diversionary programs to address the needs of these youth. Currently, we do have a program that exists that's the model for this, the Detention Alternative for Autistic Youth that you've heard Senator Orenshaw discuss, the Day Court program. And it's for youth that are currently involved in the juvenile justice system with the primary diagnosis of autism. It's the only program of its kind in the country. Almost all the youth in the program, they don't have any services to address their needs. Many of them don't even have an appropriate diagnosis. Often, children arrive in the juvenile justice system with diagnoses such as ADHD, ODD, OCD, conduct disorder, bipolar, anxiety, PTSD, that parents are told that are behavioral problems, for lack of a better term. And they aren't told how to address these issues. They go to residential treatment centers or they try medication and nothing works. And they can't get the assistance that they need. And just to put it in perspective, all those things that I just went over, recently we had a 12-year-old with all those diagnoses come into our system. When that happens, on those occasions, we have a team where we'll staff the youth and we'll look to arrange a neuropsych evaluation to rule out potentially ASD. And since its inception in 2018, Approximately 65% of those that we have, the neuropsych evaluations that we perform, come back with a formal diagnosis of ASD. This can include youth who have never been diagnosed, or youth who have juvenile sex offenses who have previously never been diagnosed, which the offenses are actually a result of their diagnosis and not an active deviance. Once a formal diagnosis is obtained, or if the youth already has a formal diagnosis, then the team then begins the process of obtaining the necessary diagnosis and services for that particular youth. The day court's made up entirely of people who volunteer to do extra duties that they already have. The DA, we have a DA, a public defender, probation. We also have parole community partners such as Autism Treatment Assistance Program, who helps with the paperwork and shortcuts so that they don't have as long of a wait. Desert Regional Center, they also send someone so that we can make sure we have someone to send the paperwork to so they don't have to wait. Legal Aid sends a representative for those who qualify to assist with the IEP process. So we make sure that all the needs are met in the school system. We have people who provide ABA, Project Mind, the ABA group. We also have the Collaboration Center. We have LOVA Center, Moving Mountains, Behavioral Essentials. We also provide parent training. We have the Ackerman Center that deals with us, Dr. Davis, as well as DFS, CAP, and CASA, because we do have a lot of children who are in our foster care system, as well that end up in our delinquency system with ASD diagnoses. The end goal is to obtain applied behavioral analysis services, which I'm sure you've heard about, the ABA services, before the youth turn 18. ABA can help increase communication, social skills, and decrease problem behaviors, just to name a few of the positive outcomes that we have. The parents who receive training to better prepare themselves on how to deal with those behaviors that we see in the youth, and that way we can deal with both the parents, making sure that they don't reinforce the negative behaviors, and also teaching them how to work through the behaviors that we see. And then also the youth with the ABA to make sure that they have the appropriate supports going into adulthood so that we don't see them in the adult system. We're very big proponents of ABA. I personally am here today because of ABA. My eldest daughter, who now is 25, was diagnosed on the spectrum when she was 2. By the time she was 3, she became extremely violent. And by the time she was 5, she became so violent that the doctors told us to put her in a home and get on with their life, because they figured that she was probably going to kill me, because she'd already broken bones on myself and herself as well. Without the ABA program, I can honestly tell you I wouldn't be here today. I'm trained in ABA for over 15 years with the LOVA Center. And because of ABA and the personal involvement in my life, my daughter went from 250 aggressive acts per day down to about 1 every 4 months. So, you know, I'm here to help other people be able to function in life, to not worry about going to sleep at night, not worry about the teachers, and to actually have a productive member of their family and in the community. And the success of the program has spoken for itself. We have graduated 65 youth since 2018. Of those 65, 5 have come back. Of those 5, only 1 had stayed in the ABA program that we had set up. And with that, I just want to thank everyone for their time. I apologize, I'm not there in person. I had court this morning, but I did hear all the other testimonies on the other bills that were presented today. And I heard about the things that everyone wanted to bring to Nevada. I can tell you this, we have one thing here in Nevada that no one else has, and that is the diversionary program for youth on the spectrum that is shown to be very effective. And with the passage of SB 411, we would be the first in the nation to actually codify that, to allow others to copy the program that's been successful. And with that, I'll turn it back over to Senator Orenshaw. Thank you.
Thank you very much, Judge Bailey. And Chair, I'm happy to answer any questions.
Thank you, Senator, and thank you, Judge Bailey. We have a few questions. We will go ahead and start with Assemblyman Nguyen.
Thank you, Madam Chair, and thank you, Senator, for being here, and thank you, Judge Bailey. It's good to see you on screen. Haven't seen you in a long time, so good to see you here. And I like Senator Orenshaw's style. Every time he comes to a committee, he has a judge with him. So I had a pleasure of talking to the senator on a different bill with a different committee, and he also brought a judge. So you're surrounded by judges. I'm very as this was going on, I was just thinking about things, and I think, Senator, you would not be surprised on my line of question here, but as you are looking into this program, I know that we are going to set the bar for the rest of the country to follow in terms of things that could benefit our young population as well as the families are involved. In terms of creating and modernizing, how our laws work to be able to be accommodating to all members of our community. I want to make sure that if we're going to fix kind of like the setup of this, in terms of your working knowledge, and maybe Judge Bailey may have working knowledge of this, is that are there cases of folks on the spectrum adding on to the barrier of language? So there are families, especially, both Judge Bailey and I are APIs, so, we're dealing with populations of parents who are so afraid to talk about this publicly, to seek help just because of that language barrier. So when we are looking at revises, even the membership, some of the membership on the Nevada Commission on Autism Spectrum Disorders, I just want to see how we can embrace the language access community and be able to have folks who sit on this group or even part of the program that could really address the language access issues that we have in terms of all of the health issues in our state. And I don't know if Judge Bailey or you have any stats on cases that you dealt with that have language access barriers.
James Orenshaw, State Senate District 21, through you, Chair, to Assemblyman Nguyen.
Please feel free to go direct.
Oh, thank you, Chair. I don't have any statistics right now about with me, and I'm not sure if they're available, but I could certainly try to see if they are and if I can find them. Certainly, as an attorney who practices in juvenile court, one thing I have noticed is that in juvenile court in Clark County, the next weekday after a child is arrested and brought into juvenile detention, there's a hearing, a detention hearing, which is like an OR hearing in adult court, because there's no bail bonds in juvenile court. And very often, one thing I've noticed, and I think it speaks to the collaborative effort of the day court model, is that even though those OR hearings, those detention hearings, are not usually in front of Judge Bailey, they're usually in front of hearing masters. The district attorneys, the public defenders, if they see a child where, even if they haven't been diagnosed with being on the spectrum, there's indications that there might be a child who's on the spectrum but just never got diagnosed, a lot of times there'll be a referral for that child to go to the day court program. Certainly, I've seen children and families, who've needed assistance of foreign language interpreters, where that referral has been made. As to how many, that I don't know, but I think we'd be able to find that. And then to speak to section, the latter section of the bill, Section 2, dealing with the Commission on Autism Spectrum Disorders, the problem that I am trying to solve there is it was brought to my attention that there was an issue with the commission, which through the last 15 years has really been tremendous in terms of working on medical insurance for kids on the autism spectrum, really helped with the parents and Judge Bailey on pushing for big changes in Nevada law. But lately they've had an issue with having quorum. And this is trying to make sure that the quorum would be counted among the voting members, not among the non-voting members, and try to make sure that they can have quorum when their meetings happen. So I'm not sure about data as to children who need foreign language interpreters right now who got referred to the autism court. That might be something I could reach out to the Office of the Courts and try to find out. But I believe that there have been, and I've seen where there's this collaborative effort to try to send kids to that therapeutic diversion court who maybe get the help they need and not, be maybe put on probation or sent to a youth facility where they're not going to get the help they need.
And I can add to that. This is Judge Bailey adding to that, Assemblyman. We also deal with interpreters. Interpreters are available for everyone who comes before us. As far as the community, I can tell you that we've had a lot of community outreach, including the AAPI community. There's a new organization called SOFA that's been reaching out that we did public service announcements for. In addition, there's Azul Blue, so we have Spanish as well. And so we always try to make sure that we have the access for everyone out in the community to make sure that they understand that autism is not something that they need to be embarrassed about and that we can help provide the necessary assistance.
Quick follow-up, Chair. Thank you. So, yeah, I just wanted to make sure that I put this on the record that as we just modernizing and improving all of our processes here in Nevada, and of course with the recent growth of the AAPI community and the language access community, I want to make sure that we're just intentional when we are doing things so that we can include these communities as far as being a part of the table and be able to provide input, because there are some cultural competencies, things that we definitely want to be aware of. And I am embarrassed to say that I want to recognize and honor Judge Bailey for telling her stories, because as long as I've known her, maybe she did said about it, but I just did not hear that until now. So thank you, Judge, for sharing your story. I know that's sometimes, especially for the Asian community, it's difficult to share our personal stories, and I want to thank you for sharing that. And I hope to, for us to move forward to include a lot of these cultural competency and language access initiative in all of our initiative addressing health challenges that we have in our state. So with that, I yield. Thank you so much, Chair.
Thank you for the questions. I think you bring up an interesting point in these voting and non-voting positions and quorum issue. We heard just last week about a similar situation in which the local government folks were not making it to the committee that they had been committed to, or even appointing folks to that committee from the local government. So it seems to be a trend that might be worth digging into, that the local governments don't have adequate staffing to be able to make these committees, but it's really dragging things down when quorums can't be made. So interesting trend we're seeing in here. I have another question from Assemblywoman Thomas. Please go ahead.
Thank you, Madam Chair, and thank you, Senator and Judge Bailey, for bringing this forward. I see halos over your heads. This is something that I think you should be on, the mountaintop screaming. Because right now, I hate that we're in a diversion court for juveniles rather than getting them before they become into the system. I think that some of the programs that you have stated here should be in our educational side of the house, so that the kids would not be wrapped up into this system and going into the court, going through this whole long process. Because once you get into the court system, it's hard to get yourself out of the system. And it's hard for the students, it's hard for the parents. My questions, I actually have a couple of questions here. The educational aspect, once the kids are in the program, how do we educate our kids? How do, I know that CCSD has a behavioral program, schools, we used to call it alternative schools, that we send kids that have a behavioral problem. Is this when you extract them knowing that they do have autistic diagnosis? And I find that kind of hard to believe, because a lot of the schools do not have licensed counselors to see that, and a lot of our schools are not looking at that. They're just saying it's a behavioral problem, and they send them, expel them, or they're out on the street, and then that's when Metro and our police agencies get a hold of them, and then they get into the system, and this is a merry-go-round for our kids. So question is, do you work hand in hand with the alternative schools? Do you work hand in hand with the schools itself in order to eradicate the problem before it gets to the courts?
James Ornshaw, State Senate 21, Assemblywoman Thomas. I appreciate your kind comments, but there's no hail over my head. Judge Bailey is the one who decided that there needed to be a therapeutic court for kids on the spectrum, and I learned about it from her work. And in terms of education, I've certainly seen her and some of the hearing masters, other judges, try to help families and parents maybe either get the IEP corrected if a child has an IEP and if it's not working, or if they don't have an IEP in the first place and need one, try to maybe refer them to an organization like Nevada PEP or some other group that might help them with that IEP. So I think there is a lot of collaboration that I've seen in terms of the day court. I've seen attorneys from legal aid be there, and Legal Aid Center has a education defense group there that actually helps parents and children if there is a problem with a school, the IEP, and I know we've referred some kids there when there are issues with the school not tailoring that IEP for the child. So, I think there are limitations as to how much, what any court can order the schools to do, but I think there is a lot of collaboration that comes out of the day court, and a lot of children do get help there.
And this is Judge Bailey adding to that. I wish we could be more involved with the schools. Unfortunately, it's just a bit too big to try to take care of at one time. What we do is we work with legal aid and with the individuals on their IEPs to make sure they meet the needs and that the school's meeting the needs of each individual under FAPE and IDEA. Often what happens is because our youth have not been diagnosed with autism, they don't have an appropriate IEP. They may only have a 504 or a behavioral plan that doesn't actually address their needs. So the first thing that we do is we make sure that we have an appropriate IEP that functions for them with their autism diagnosis. For example, we had a youth that came in with cochlear implants and autism. The school district had only given him an IEP for the cochlear implants. Well, we had behaviors due to autism. So obviously we wanted that IEP to address his behaviors due to the autism, so that way he was protected under FAPE and IDEA as well. So legal aid actually took on that challenge, and they made sure that the IEP addressed the appropriate needs. And once it was corrected for both cochlear implants and autism, then we found out that the school was much better suited for him, and he did a much better job, and he was able to fit in and able to not have the behaviors because everyone was able to recognize the behaviors and address them through the autism because they were a function of the autism and not a function of a different issue. So once we were able to determine what the function was, then we could help the school. So we're actually able to help protect the school, which is the goal, the protection of the school and the other students and the other teachers as well.
Thank you. And follow up, Chair, please. Thank you. How long is this program, the diversionary court program for the students? How long are they in this program?
And this is Judge Bailey again. Thank you for that question. The answer is it depends whether or not we already have a diagnosis. If we already have a diagnosis, then we can immediately get them set up for the ABA. If we don't have a diagnosis, then we have to get them to a neuropsych. We have a shortcut into a neuropsych that we can get them in within 3 months. Some people who have out-of-state diagnoses, Medicaid will not accept an out-of-state diagnosis. So then we have to get them to a neuro, and then we have to get that evaluation and then start over. So it can average about 1 year to 18 months because we're dealing with all the different behaviors and the positive reinforcement with the parent training. It takes us up to 6 months to 9 months just to get the diagnoses and get them started and on all the wait lists for the ABA and the neuropsych. And in the meantime, we're also dealing with all the other behaviors to make sure they don't continually come into our system.
I did not know, like we learn something new every day in this committee, I did not know that Medicaid gate kept autism diagnoses in the state. That is an interesting issue. Again, would encourage folks who are interested to follow up on that one. I have another question, and this is the last one on my list, so if I missed you, please let me know. Assemblywoman Gorlow.
Thank you very much, Chair. And my apologies, I had a hearing I had to go present in, so I did miss a lot of the presentation. So this may have been covered, but I was curious if there was conversations about also looking at adding children on the FASD spectrum as well, since many of them exhibit the same characteristics. Thank you.
This is Judge Sunny Bailey, and at this point, We have been asked if we're willing to accept FAS at this time. Right now, we have so many requests for FAS evaluations and then follow-up that it's a little larger than our volunteers can handle. So right now, it's not projected for us to be able to handle that type of volume, but it is something that we're looking at for the future. We do assist with those who need FAS evaluations. We have been able to assist them in getting the evaluation quicker with the Ackerman Center. So we've shortened up the wait from 18 months down to about 3 months. And then we still do help connect them with the DRC and the ABA services to the best of our ability as well.
Thank you very much, and that's impressive on getting that wait list down that much, so thank you very much.
It's impressive how much of this is run on volunteers as well, because it touches so many good issues, wholesome issues, right? Making sure that we are addressing folks and their needs where they're at. I really appreciate the bill.
Thank you, Chair. And James Orenshaw, Senate 21. I think Assemblywoman Thomas put it best. I think a lot of the kids on the spectrum, if they don't get into a therapeutic program like this and don't get services that would help them, we'll probably end up on a cycle where they're on juvenile probation and they're not going to succeed. And then they might have a violation of probation. They might pick up new charges. And I think that Judge Bailey's program has helped so many children not end up in that cycle where they're years of not succeeding and not getting the benefit of the services probation's trying to give. And if this is expanded to other counties, other jurisdictions, I think that's got the potential to divert a lot of kids from either ending up on juvenile probation, adjudicated delinquent, or local, or regional, or state youth correctional facilities. So I appreciate your hearing the bill, and I hope you might consider it.
Thank you. Are there any other questions from the committee before we move into testimony? We'll go ahead and move into testimony then. Thank you, Judge Bailey, for being here. Thank you, Senator, for the presentation. We will start with support testimony in our physical locations here in Carson City and Las Vegas. Please come up to the table, fill in the chairs. Remember to state your name for the record before you begin. You may begin.
Thank you, Madam Chair. John Puro from the Clark County Public Defender's Office, also testifying on behalf of the Washoe County Public Defender's Office. I want to thank Senator Orenshaw and Judge Bailey for bringing this bill forward. I think it's very important that when we're dealing with issues outside of the normal purview, our courts take notice of that and treat people with dignity and respect and get them the treatment that they deserve and they need so that we can stop a cycle from starting. And this court is a good first step towards that. And so I thank the sponsors for bringing it forward and urge this committee to support it.
Afternoon, Chair Peters, members of the committee. My name is John Abel, Government Affairs Director for the LVPPA. We as well support this bill. It's often law enforcement officers who go on calls for service and have to come in contact with these children who are on the autistic spectrum. And unfortunately, sometimes have had to use deadly force, which is very, very sad. So I believe, and our officers believe, that this program will limit those interactions with law enforcement. Anything that we can do to set them up for success in the future as adults is very much appreciated. So for that, we support this bill. Thank you.
Chair, members of the committee, Jonathan Norman with the Nevada Coalition of Legal Service Providers. Before taking this position, I had the pleasure of being the education attorney in day court, working with Judge Bailey and the other stakeholders. And it is an awesome program. And to Assemblywoman Thomas's question, day court is one avenue to services at legal aid. We take community referrals. So when you have, just a plug, when you have people who need education assistance, legal aid center's there for that. I've seen the power of day court and connecting families to services. And what you really have is you have a parent who's totally overwhelmed, right? They are dealing with these charges on top of behaviors they're probably seeing in their own home, and they just don't know where to turn. And the real power of day court is all those professionals are there, and Judge Bailey's able to say, what's going on with the IEP? The parent says, not sure, and she's like, you need legal aid. And there's no go to legal aid's office. They don't have to take steps. We get their information right there, and we contact them and make sure we follow up on the IEP. And the same for the other providers, whether it's ATAP, So it's a great program, and we're supportive of the bill, and thank you to the senator.
Thank you. That concludes, I think, support testimony in our physical locations. I don't see anybody in Las Vegas as either. Would move to the phones. BPS, is there anyone on the public line for support testimony on Senate Bill 411?
To testify in support of Senate Bill 411, please press star 9 now to take your place in the queue.
Good afternoon, Madam Chair and members of the committee. Stephen Cohen, for the record. Stephen with a B. Cohen is in the Assemblywoman, no known relation. Ditto. Thank you.
Thank you. Next caller, please.
Hello, Julia Ostrowski for the record.
Welcome, please proceed.
I am the past, sorry, there's a big delay. I am a past commissioner on the Commission on Autism Spectrum Disorders. The commission did not meet my last 6 months of my appointment because of the inability to get a quorum. I'm the founder of Autism Community Trust and the parent of a fantastic nonverbal young adult diagnosed with autism. I'm here today in support of SB 411. Thank you, Senator Orenshaw and Judge Bailey. What I have witnessed through the remarkable efforts and passion of Judge Bailey, it changes lives. And it makes our community safer and a better place to live. Undiagnosed autism is not a crime, but rather an unfortunate circumstance. By identifying what is causing criminal or violent behaviors and then offering the opportunity to intervene and change those behaviors is life-saving and life-changing. The second piece of this bill deals with the Commission on Autism Spectrum Disorders. The Commission monitors services for people with autism throughout the state and works to improve access to services throughout the state of Nevada. The challenge faced by the Commission is establishing a quorum due to unfilled vacancies and scheduling conflicts, restricting the success of the Commission. This small fix will empower the newly appointed commissioners to work to improve the lives of people with autism. I strongly encourage you to support all of SB 411.
Thank you. BPS, are there additional callers in support of SB 411?
Chair, there are no other callers to testify in support at this time.
Thank you. We'll move into opposition testimony in our physical locations. Is there anyone who'd like to provide opposition testimony on Senate Bill 411? Seeing no one coming to the desk in Carson City or Las Vegas, we move to the phones. BPS, is there anyone on the phones for opposition testimony on SB 411?
Chair, there are no callers to testify in opposition at this time.
We will move into neutral testimony. Anyone in our physical locations who would like to provide neutral testimony today? Seeing no one coming to the desks, BPS, is there anyone on the public line to provide neutral testimony on Senate Bill 411?
Chair, there are no callers to testify in neutral at this time.
Thank you. Senator, would you like to have some closing remarks?
Chair, members of the committee, thank you so much. James Orenshaw, Senate District 21. Thank you for hearing Senate Bill 411. I believe that if this passes and if we see more of these therapeutic diversion courts throughout our state, that more kids will be diverted from ending up either on probation or at a regional or state youth correctional facility. And with your permission, Chair, may Judge Bailey make brief closing arguments? Thank you.
Do we still have Judge Bailey with us? Please go ahead.
Yes, I'm still here. Thank you, everyone, for your time this afternoon. I'm sorry I couldn't be there in person. Thank you for your consideration of SB 411 and the strong community support in favor of this diversionary program. For any members of the Assembly, if you'd like to witness yourself what we do hold video court as well. It's on Thursday afternoons. If you'd like to get a hold of Senator Orenshaw, we'd be more than happy to send you a link so you could see what we do in action. please feel free to come check us out, come see what we do on a weekly basis, and we'll let you know what our calendar looks like and which ones are open or not. But thank you again for your time, and we would just encourage passage of SB 411. Thank you.
Thank you. Thank you for your time and presentation today.
Thank you for hearing the bill. Thank you, members.
We'll go ahead and close the hearing on Senate Bill 411, and that takes us to the end of our bill hearings today and to the last item on our agenda, which is public comment. We are asking that public comment be limited to 2 minutes to ensure there's a fair opportunity for folks to provide public comment. Public comment may also be provided in writing as indicated on the agenda. Is there anyone in Carson City or Las Vegas that would like to provide public comment today? Seeing no one coming to the desks, BPS, is there anyone on the public line who would like to provide public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue. Chair, there are no callers choosing to provide public comment at this time.
Thank you so much. We'll close out public comment today, and that brings us to the end of our day. We all have a very exciting event tonight at 5 p.m. I hope to see you all there, dressed in your scrubs or best physician attire, physician, nurse, healthcare practitioner attire. With that, we do have committee on Wednesday. Please keep an eye out for work session documents as they're prepared. And then we will likely have committee on Friday, just so you all have an awareness for travel plans. With that, we are adjourned.